Burning topic. Dr. Podar, this is, it invites at least 20 questions, sir. Lot of speakers. Dr. Taneja. He's left? Okay. Okay. So, he said PSA of less than 2.5 need to be tested only in 2 years. About 2.5 yearly testing. Doubling of PSA signifies CA. Is that true?
Absolutely. And this is not what anybody has said. This has come from over longitudinal studies for over 15, 20 years. And if suppose one time you have tested, you're 45 years of age, and you get your PSA done as part of any health check, and your PSA comes as 0.65, you need not test your PSA for the next 10 years. But if your PSA comes as 2.5, if, God forbid, anybody in your family has died of prostate cancer, your uncle, your brother, your dad, anybody in the family has died of prostate cancer, then it makes a lot of sense.
So, family history is important.
Very, very important. Very, very important. And the baseline PSA after the age of 45 is very, very important. At the age, not after, at the age of 45 is very, very important. If your baseline PSA at the age of 45 is 0.6, rest assured, don't get it done for the next 10 years. It will be alright. This is what the studies have shown.
Sir, 80% of the people above 80 years will have CA prostate.
Yes.
So, but only 1 in 25 will probably die of CA prostate. How far is that true?
See, these are all the statistics. All that I can tell you.
This is US statistics. What about India?
India, unfortunately, we don't have the statistics. But in Indian statistics, what we get are advanced cancers. I can only tell you that I have a patient who was diagnosed with prostate cancer at 75 years of age. His PSA was 500. He is still with me at the age of 87 years, and his PSA is approximately 70, and he has had all sorts of treatments for 12 years duration, and he's still with me.
Would you say that if the age is more, probably the CA prostate is less virulent?
The behavior of the prostate cancer depends upon the age at which it is diagnosed. If it is diagnosed beyond 75 years of age, and that is why nowhere, even the United States, they recommend a PSA screening after 75 years of age. They don't recommend that. I don't practice it because it raises unnecessary, concerns within the family. So if a person comes to me at 75 years of age, I do a rectal examination. Rectal examination is normal. I don't do a PSA for him.
So would you say, so sir, would you say after the age of 75 or 80, the CA prostate is probably less virulent?
It is less virulent. It will certainly cause you symptoms. It is less virulent and it is very well active in the water.
Sir, the BRCA 1 and 2 are implicated with ovarian and breast cancer. But the HPV and the HSV2 are complicated with CA prostate. Would you agree to that? Sir, again I repeat.
No, I got it. HSV1 and HPV, they are more with genital cancers. Okay?
Sir, we are talking about CA prostate.
No, I don't see a direct correlation to CA prostate. There are no studies to really prove it.
Sir.
And I can only tell you that if there is something today in the literature, you can see it down in 5 years and it is changed. The European as well as the American guidelines, they differ a lot in what they want to say. The last statement of the American professor in our meeting was that you guys are probably more intelligent as Indians because you're not doing a PSA screening. We have had it. We have had millions of cancer prostate surgery and we still don't know whether PSA is saving lives.
So would you say then the HPV and the HSV2 are not implicated in the CA prostate?
Not certainly.
Not certainly.
Not certainly.
That means you're not sure.
Not certain. No, I'm saying that the researchers are not sure about that.
You're not sure.
Researchers are not sure even about themselves.
Sir, Dr. Arora.
See, it depends upon what extent you want to do. Now, if you this girl, what is her name? Angelina.
Yeah, Angelina, yeah.
She has got her bilateral mastectomy and
Overectomies, yes.
for BRCA.
She has a very strong family history. She has a very strong family history.
So, you want to die aborted man, you want to die an important man.
Right.
It's your call at the end of the day.
Dr. Arora. Sir, recent trends in MRI imaging, you said 85% are curable with radical prostatectomy, well localized. 75% probably are peripheral, you see, and then probably 25% in the central zone. How far is that true? That's true. Right.
There is enough literature to support what I have said. That is the what literature, that is the part medicine that we practice.
It's a little confusing, the role of MRI in stage 3. You said you need to do a DCI with MRI, the DW1 and the MRSA, and the combined.
Is that diagnostic criteria, as I say, you do plain MR, you do hypointense, you do diffusion weighting, you do contrast, you do PPI, and you do spectroscopy.
And you combine.
And more than if the same area is seen positive in more than two modalities, such evaluations, then the sensitivity and the sensitivity is higher.
Beyond 80%.
Beyond 80%. Sir, what about the CPU T cancer vaccine?
I can tell you that.
Yeah, please.
Cipillucin T is a cancer vaccine, and it is useful for patients who had, a low risk practice. Cipillucin T is for low risk practice. Suppose that the hormonal treatment is started for a patient, and the hormonal treatment fails. Then what are the options available once the hormonal treatment is failed? So this is a tumor vaccine, which is still not available in India because it is being used elsewhere, but it is not available here with us. But it will soon be available. And this can be used for a low risk disease. Cipillucin T. It can be used for a low risk disease.
So, Dr. Agarwal, I'm a big fan of the robotic surgery.
Even I am surprised.
So, last question. So, is it the gold standard now for CA prostate? Would you say that?
Exactly, it is now. Now it is.
Why, sir?
It is because that the outcomes which are coming over. Now, the robotic surgery started in the year 2000. The techniques were defined in the year 2002. And the outcomes that we have now, in terms of patient morbidity, in terms of the ability to preserve the neurovascular bundles, in terms of the ability to preserve the conduits, I can tell you, I have attended lectures of Patrick, who are the father of radical prostatectomy. He has done more than 10,000 prostatectomies. His results have been duplicated by robotic surgeons who have done 500 prostatectomies. So if you achieve a competence level after doing 10,000, the same competence can be achieved by 500 surgeons. That is a 30 times more important. Okay, so that is the reason why robotic surgery has been picked up. In the United States is the place where the highest number of radical prostatectomies are picked up because they have a very strong cancer screening program in terms of PSA screening. Europe does not have that, but the United States have. So in the United States currently, 80% of the surgeries for cancer prostate are robotic surgery, and very soon India is going to be the next step.
So, what are the big advantages? Sir,
Big advantage.
let me tell you, erectile dysfunction probably is not there. The incontinence,
No, erectile dysfunction is very much there, especially in the
No.
Indian population. Because
no, sir.
later
After
disease.
robotics, if you do a robotic surgery,
See, the principles of surgery are the same. If you have a disease which is going beyond the prostate into the neurovascular bundle, you have to sacrifice.
okay,
You cannot compromise cancer cure for erectile function because erectile function can be restored by several other means. by means of vacuum pumps, by means of penile prosthesis, erectile function can be restored.
Sir,
Yeah.
Dr. Agarwal, if you do a robotic probably surgery, probably the erectile dysfunction and the urinary incontinence is less as compared to the radical prostatectomy that you do.
Open.
Yeah.
Absolutely.
Yes.
Yes.
So how much percentage would you say probably is less with robotic as compared to the radical?
I'll tell you. In my hands, when I did open radical prostatectomy, patients were 100% incontinent for at least 3 months. Now, patients are 90% continent in the first month.
That's great.
So that is the difference in my hands.
That's great.
Experience was
Some basic
much-
questions.